How does the IGRA test detect tuberculosis? Imagine a simple blood test that can tell if someone has been infected with tuberculosis bacteria. That's exactly what the Interferon Gamma Release Assay, or IGRA, does. It works by checking how your immune system reacts to specific parts of the bacteria. When someone has TB, their immune cells, called T cells, recognize these bacteria and respond by releasing a signaling protein known as interferon gamma. The IGRA test measures how much of this interferon gamma is released after exposure to TB-specific proteins. The test uses special peptides that mimic to proteins called ESAT6 and CFP10. These proteins are unique to the bacteria that cause tuberculosis and are not found in the bacteria used in the BCG vaccine or most other non-tuberculous mycobacteria. This makes the test highly specific for TB infection. When a blood sample is taken from the patient, it is mixed with these proteins. If the immune system has encountered TB before, the T cells will recognize these proteins and produce interferon gamma. The amount of interferon gamma released is then measured using two main methods. One is called enzyme-linked immunosorbent assay, or ELISA, which quantifies the exact amount of interferon gamma in the blood. The other method counts the number of T cells producing interferon gamma. Both approaches help determine if the person has been infected with TB bacteria. It is important to note that the IGRA test is mainly used to detect latent TB infection, meaning the bacteria are present but not causing symptoms. It cannot tell if the infection has become active or if the person has active TB disease. The test is considered more specific than the traditional tuberculin skin test, especially in people who have received the BCG vaccine or have been exposed to other mycobacteria. Because of its accuracy, health authorities in many countries recommend IGRA as an alternative to the skin test, particularly in low TB prevalence areas. In summary, the IGRA test detects TB infection by measuring how T cells in your blood respond to TB-specific proteins. If your immune system recognizes these proteins and releases interferon gamma, the test indicates a TB infection. Always remember, if you have concerns about TB or testing options, it is best to consult a healthcare professional for personalized advice and further evaluation.